Hey there, Hank.
Right.
So you're supposed to get a biopsy tomorrow, is that right?
Yeah, they didn't schedule it when they done the bone marrow biopsy.
Okay.
Yeah, they didn't schedule the bone marrow biopsy till the day before.
Yeah, I don't remember whether my substitute nurse was working at that point. Can't remember. Tony was out for a little while. It was kind of topsy-turvy. Let's see what the bone marrow shows. So in the bone marrow, they did find, I guess we can actually cancel that biopsy. So the bone marrow biopsy does confirm that this is a type of lymphoma, a type of what's called a B-cell lymphoma, and specifically something called mantle cell lymphoma. So the cellularity is about normal. So that establishes the diagnosis. So we do not need a biopsy of the lymph node. What we do need is to put you on chemotherapy. Do you have any heart issues at all?
I've got 3 stents
Okay.
in my right artery.
Who is your heart doctor?
Dr.
Saporito.
Saporito.
Saporito. Okay, very good.
They said I had blockage, but there was never no damage to the heart.
Okay, so the squeeze of the heart is normal.
The first time they put the stents in, I was like 99% blockage. They said there wasn't no damage. And the second time they put one stent in, I was like 60%.
Okay. Have they done a recent like sound wave test or nuclear stress test or anything
No,
like that?
not recently.
Okay. Well, we will get that done at Saporito's office.
Yeah, he ain't seen him in a long time.
Okay. Is there going to be any trouble getting you back in to see him?
I think I have to give them $100
Okay.
or something like that.
So he doesn't have to take that for tomorrow?
Correct.
How long does he have to be on chemo?
For approximately 6 months.
It was that once a week, twice a week.
We're going to get there in just a second.
Okay.
So the type of this lymphoma is something called a mantle cell lymphoma. And that is important because it's a little bit more complicated than some of the other lymphomas. So by and large, we want to try to be relatively aggressive about it if you're younger and healthier and we think you can tolerate it. If you're older, if you're in your 80s, well, no, then we're not going to be aggressive about it. The thing is, there's not universal agreement as to what the best way to proceed is. And there, one of the most current thinking is that treatment with aggressive chemotherapy with what's called stem cell transplant, so sort of like a bone marrow transplant regimen, is actually probably the way we'd like to go with younger, healthier people who could tolerate it, which I think you probably fit that category. The thing is, that's not something we do here. We would have to send you somewhere, a bigger cancer place like Little Rock or Houston or Dallas or someplace like that, pursue that treatment. Now, often what we do is we work in collaboration with these guys. So some of the aggressive chemotherapy would be done there, and the stem cell transplant would be done there. But other stuff could be done here, any monitoring we need to do, and if there's any what we call maintenance chemotherapy, and that needs to be done, or induction chemotherapy, any sort of regular community-based things we could do here.
Excuse me.
Sure. No, that's fine. You're fine. So that's actually how we would probably want to proceed in an ideal circumstance. That's tough. I mean, that requires, you to be able to, travel to some place and have someone go with you and help take care of you, because in the middle of all this, you certainly need somebody with you. You need to, when you do the stem cell transplant, if that is what they feel is the best thing to proceed with, wherever it gets done, Little Rock, Dallas, Houston, you generally need to be in that city for about a month. So, there's long-term housing considerations, these long-stay hotel facility type things. It requires a lot of resources to be able to get something like this done. So if we can do that, that's generally the way we prefer to go. If we cannot do that, certainly there are other treatments that we could do locally, and they're perfectly good treatments, they're just not necessarily the best treatment. So the thing is with mantle cell lymphomas is they often respond very well, even to regular chemotherapy. They respond, they shrink up, but they tend to come back. So that's why in recent years we've gone to more and more aggressive approaches to see if we can get better outcomes, to see if not only can we put people into remission, which we can do with regular chemotherapy, but can we keep them in remission longer by doing these aggressive therapies? So that's the first question we have to answer. Is that something you'd be interested in? And if so, where do we want to send you?
I want to get well, yeah, so.
Okay, well, I agree. That's what I want for you, too. Do you live on the Texas side or the Arkansas side?
Arkansas.
UAMS has a fantastic transplant, a stem cell transplant program. Mainly they do it for multiple myeloma. But their stem cell transplant program has been around for 25 years, and it's literally one of the best in the world. So I think probably the easiest thing and the closest thing would be Little Rock, and they're really, really good. And like I said, I collaborate with them all the time. We have all kinds of patients in common. So whatever they needed to get done locally, we would be happy to do locally and have the heavy parts of the treatment done up there in Little Rock. So that would be my recommendation. Get your referral to Little Rock, get you sent up there, and they would sit down and talk to you and decide on a course of action. And if in fact stem cell transplant is the way to go, then everything will move on and we'll go from there.
And they have our financial assistance and everything also.
I don't know exactly what their exact situation is, but the only thing you'd have to just go and talk to them.
Because I've applied for Arkansas Medicaid. I ain't heard anything from them yet.
Okay. I mean, generally with Arkansas residents, we don't have a whole lot of issues getting folks seen at UAMS. Usually they're pretty good about doing that. But the exact specifics, I'd have to leave that up to them.
Okay, I was just thinking maybe you might know a little bit. That's why I was asking, because I don't know what kind of pain in the butt it was getting all this here done.
Right. But they're a state-sponsored facility, so they get funding from the state. So they're expected to take care of Arkansas residents. So I don't know exactly how all that stuff shakes out, but they're a research facility. They get research funding. So, but by and large, we've had good luck getting folks out there and getting treated and getting the stuff they need to be on.
Okay.
Let me write that. This would be considered stage 4, since this does involve your bone marrow. And stage 4 is the most advanced stage of lymphoma. So the overall cellularity is about 50%. Which is normal. So your bone marrow there's a bunch of cells in your bone marrow and there's a bunch of fat in your bone marrow. And the ratio of the cells to the fat of someone your age should be about 50-50. And it is. 50% cells, 50% fat. But of those 50% of the stuff that cells, about 30% of those are lymphoma cells. So, and the big spleen and everything else going on, the lymph nodes, that's all consistent with mantle cell lymphoma. And there's a bunch of fancy tests that they did on this, and we'll send them all the results. There's a good chance they're going to repeat your bone marrow biopsy. Can't help that. They're big fancy research institution and they like having their own information.
Yeah.
So that may be done. But I don't know. Our sample that we got is pretty unequivocal. I mean, it's pretty straightforward. So they may just get the slides and look at them and rather than repeating it. But I'll have to leave that up to them. So we'll make the referral. It usually takes about 2 weeks for them to get back in touch with you. So if you haven't heard anything in about 2 weeks, call me back.
Okay.
Will we get an answer?
I hope so too.
Because she is hell to get a hold of.
Who's that? Latoya?
Yeah, anybody up here.
A big part of that is Latoya was out for close to 2 weeks. And it was just haywire.
Tell her not to do that no more.
Well, sometimes it's not avoidable.
So in the meantime, I can go on doing what I can tolerate doing.
Go do what you can tolerate doing. So, what is your sort of normal stuff?
Well, we've got that little farm, but she takes care of everything now, so.
Okay. Your spleen is very, very big. So don't go riding horses.
No.
Don't go climbing up high ladders that you can fall off of and fall and rupture your spleen. So anything that doesn't cause trauma to your abdomen, have at it. You can do whatever you want.
Okay.
All right. You can go ahead and head on out and we'll get to work on that.
All right, so then I guess I need to stop and talk to her. She said she was going to cancel that.
Oh, okay. You can do that too. So we can cancel Mr. Denton's biopsy
Okay.
because the bone marrow is diagnostic. But we need to refer him to UAMS to see if they want to do a stem cell transplant.
Okay.
All right, we'll get you taken care of.
All right.
Go ahead and go.
All right, you're going to give me a call?
UAMS will.
They will. Okay, thank you.
You're welcome.